Hi, my name is Shailey Prasad. I'm a physician. I'm also the Executive Director for the Center for Global Health and Social Responsibility at the University of Minnesota. I'm a faculty in family medicine and community health there too. That's a very good question. I think I have to go back to the history of where family medicine has grown in the US. In the late 60s and early 70s, there was a countercultural movement against established medical care because we felt that established medical care was doing too many tests and too many procedures without really getting to patient care. And so family medicine grew in that environment where we became patient centered and more towards wellness care along with the sickness care. That led to more training programs in family medicine that has grown significantly since the early 70s. By no means am I saying that the model in the US is perfect. I would like to see more family physicians. Currently, we think about 30% of the practicing physicians in the US are primary care, family medicine primarily. Ideally, we would like it to be about 50% of all physicians, all healthcare delivery occurring through family medicine and primary care, and about 50% all the other specialties combined. That is shown to be very effective in improving quality in healthcare, decreasing costs in healthcare, and definitely improving the patient experience part of healthcare. So in the US, we are definitely at a stage where I would like to see more family medicine, and even there is significant regional differences. Some parts of the US, particularly the Midwest and the upper Midwest areas, are rich in family medicine. And some of the parts, for example, the South or the East Coast, they are not as high a family medicine spot, though there are some remarkable programs in those areas too. So there's a lot of confusion as to what family medicine exactly means because people get confused with the terminology of what family medicine is. And family medicine is true primary care. What that means is that the family physician, from a clinical perspective, is the first contact that the patient has, is the one who maintains a continuity with the patient, so gets to know the patient really well over the entire lifespan, is very comprehensive in the approach towards patient care, which means that the family physician is available for all kinds of medical aspects and the non-medical, the psychological aspects, the social aspects which affect the health of the individual. And the family medicine physician is also the person who coordinates care where there is a need for a specialist, for example. It is not a situation where we would say that I'm done with you, go and see a particular specialist. It's the ability to comfortably work with a specialist while being a patient advocate at the same time. So the scope of practice of family physicians is broad. It's entirely within the realm of clinical practice, but also significantly includes the wellness aspect of a person. By definition, family medicine also includes members of the family, like how does a person fit in within the family unit, and is strongly community based. Good question. The scope of practice of family medicine globally changes from one country to another based on the training models available and the health systems. Some places, like for example in the United Kingdom, family medicine, the general practitioners there have a much bigger say in the healthcare delivery models. In some other places like Cuba, it's been wonderful to see the entire health system structured around family medicine. The US is not at that stage. And there are other countries in the world where we feel that family medicine should be the mainstay of healthcare delivery, and they're not there yet. So for example, if I were to transition to where family medicine is in India right now, the old model of MBBS physician doing a compulsory rotating internship and then ready to practice was the model in which care delivery was occurring. What we are saying is in family medicine, we give that particular person a little more robust clinical training. So you get a 3-year training after that first one year internship, and is available to take care of the breadth of problems that the physician will be facing out in the community. So that is a model we feel would be really useful for care delivery, where a patient doesn't have to go directly to a specialist. There are enough experiments and research that have shown that going directly to a specialist may not be beneficial for the patient, partly because of the amount of testing, partly because of the cost, and partly because sometimes a specialist can be a very rare resource and they should be available to take care of the ones that really need them. So having a family physician drive that care delivery becomes an important model. That is a very good question, and I think one of the important parts is to value family medicine in the healthcare delivery. So for example, if the health policy within the country emphasizes the importance of family medicine as an integral part of healthcare delivery, then people recognize that it's an important part. The second part of it is, traditionally in India, the family physician, without a terminology of family physician, has been an integral part of healthcare delivery. People talk about the physician that they knew in childhood, for example. What we are saying is now that part becomes much more important. The second part about it is, it's partly up to the family physician to build the clientele, to be available as a person who will take care of an individual or a family and gain the trust of that person, so that the individual or a family will come back to the family physician and is available for all care. So I think it is a two-pronged approach. One of it is at the larger picture, macro policy level, making it more available, making family medicine an integral part of the healthcare delivery. And on the personal level, the family physicians themselves show the value of what they bring to the equation. As the need for healthcare increases, the need for family physician being the one who would be the coordinator of care becomes very important. Because one of the important things in modern medicine is, the more highly specialized you get, the more technical it gets, there sometimes needs to be a question, do we really need to do some of the things that we are doing? Be it medications, could they be interfering with some other field's medications? Be it testing, because testing is not the answer for good care. Testing is one part of the solution, it's not the entirety of the solution. So say for example, you have an elderly patient and there is a need for a, say a cardiology or a neurology input. Balancing the input while at the same time providing a patient-centered care, not an organ system centered care, is important. The other point that is important in an aging population is where that person fits in with the rest of the family. What kind of stress is happening to the rest of the family when they see their loved one getting older. That is part of what the family physician has to deal with too. And providing those cares beyond the, here is a medicine, take it, don't bother me, to integrating them to the care delivery, a family physician plays a very important role. Good question. I have been observing the growth of family medicine in India for the past 25 years, and I got to tell you that I'm very thrilled at the current stage. In any system, I feel there are three important components of delivering a good product in healthcare. One, there is adequate, very good academic programs that train family medicine. And in the Indian context, I'm seeing more of them forming right now. There is an energy in creating this faculty who can teach family medicine around the country. The second component of it is a market where the products from these academic programs can go and practice. What is the point in creating a product if they can't have a practice? So that is slowly happening. Is it where I'd like it to happen? No. But definitely graduating postgraduates are able to find jobs is what I'm hearing. Does there need to be more? Absolutely yes. And the third part is a very active professional organization that creates awareness in the community, lobbies at the governmental level for policy change, and also becomes the body through which everybody connects. And in India, I'm noticing the energy behind the Association of the Family Physicians of India being quite remarkable. It's a very dynamic group, it's a very active group, and the amount of work that they've put in to get some of the things done in the last few years has been absolutely amazing. So I'm more positive. I know we're not there yet, but I'm more positive for the outlook of family medicine in India.